Thank you. Thank you so much for that introduction. Okay. So I'm going to start off by giving a brief overview about why homelessness is a health issue, which is one of the things that I was asked to speak about. And then I'm also going to offer some thoughts on the possible future of housing in cities. And I'll add that in addition to my work around veteran homelessness, a big focus of my work in the last couple of years has also been around racial ethnic disparities in homelessness, with a specific focus on Latino homelessness, which I'll be talking a bit about today. So to start, homelessness is one of the most pressing policy issues of our time. In 2020, there were over 500,000 people that were identified as experiencing homelessness in our national counts. And if we look at long-term progress on the issue, it's been fairly modest. So we began collecting this data in 2007, and since then, in looking at the 2020 count, we've only seen the number decrease by about 10%. And there's recognition that homelessness disproportionately impacts communities of color. So Black and Indigenous people are disproportionately represented among those that are houseless. And this disproportionality is no doubt a byproduct of systemic inequality and the lingering effects of racism, which continue to perpetuate disparities today. And I'm sure many of you have seen this graphic before. Homelessness is a health issue. We know that the social determinants of health, so where people live, work, and play, have a greater impact on health outcomes than our healthcare system does, which only makes up about 20% of what goes into our health. Homelessness is significantly associated with chronic disease, unfavorable clinical events, and premature mortality. We estimate that nearly 40% of individuals that are homeless have a chronic health problem. And homelessness has also been associated with high rates of emergency department use, and patients experiencing homelessness are about 5 times more likely to be admitted into inpatient care than non-homeless persons, and also have longer average length of stays. And we know that homelessness is very expensive. So research suggests that the cost of public services average close to $100,000 per person per year experiencing homelessness, with about 50% of these costs being attributed to healthcare costs. And in contrast, we know that housing placement for individuals experiencing homelessness reduces healthcare expenditures. We know that it increases primary care use and overall health outcomes for this population. When people ask me, well, why do we see so many people experiencing homelessness? I really like to emphasize that at the root of homelessness is access to affordable housing. And growing income inequality has really fueled the crisis. So the middle class is disappearing, and since 1970, the gap between the richest and the poorest in our society has only continued to grow. People across the nation are also increasingly rent burdened and are unable to afford housing. So cost-burdened renters spend more than 30% of their incomes on rent and utilities each month. And in 2020, the share of burdened renters reached 46% nationally. And as I mentioned, the last several years, part of my work has focused on raising awareness about how the Latino community experiences homelessness. And this year, while homelessness increased only about 6% in Los Angeles County, it increased 26% for Latinos. And this is a pattern that we're seeing across cities in the nation, including San Francisco, seeing a high increase. And as the number of people experiencing homelessness has continued to rise, we also know that in a large part, the homeless counts underestimate the need. Homeless counts are often one point in time and include people that either can be seen through unsheltered counts or that are formally connected to the homeless service system. So those would be included in sheltered counts. And even before this year's rise in numbers, for years the Latino community was more likely to live in substandard, overcrowded, and doubled up housing. People are taking turns sleeping. You have sometimes 12 people to a 1-bedroom unit. You have folks creating beds and kitchens and hallways because there's no space to sleep. We also have folks that don't always have access to facilities, such as kitchens where they can cook, or at times even have to go to restrooms that are outside of their unit. And these folks are not being captured in our homeless count numbers. So if we only use homeless counts to understand how large the problem really is, we're missing folks that are extremely rent burdened and underhoused, living in substandard conditions. And as I've been doing this work in the past few years, one of the questions that I've been asking folks to consider is, how do we, as one of the richest nations in the world, understand and conceptualize housing need as a society? How do we define homelessness, and what do we believe it means to be fully housed? So for example, if you're not a leaseholder and you have no tenant rights, are you fully housed? If you don't have access to a kitchen where you can cook healthy meals, are you fully housed? If you're taking turns sleeping because your living environment is too crowded for everyone to rest at the same time, are you fully housed? As we think about how we address homelessness and also the resources that it takes to meet the community's needs, I think it's critical that we expand our understanding of the issue so that we're better able to gauge what resources are actually needed to solve the crisis. More and more, we see that the resources that are allocated to address homelessness are not enough. And part of this issue, I believe, is because of how we're assessing the problem at hand. And I believe that health is undoubtedly intertwined with how we fight for and frame the importance of housing affordability. And this was made ever more clear by COVID-19 that showed the health risks of overcrowded housing and also highlighted the difficulty of accessing care when one is unhoused. And our healthcare system is changing, though maybe a little bit slower than some of us would hope. We're starting to see a shift towards managed care under the Affordable Care Act, and under this, healthcare providers are increasingly paying attention to the social determinants of health. And the majority of them are now working to identify patients' needs and also linking them to community-based resources. However, there's much more that needs to be done, because even if you're able to identify the needs and then hope to link folks, what if the resources aren't available in the communities that folks are being referred to? Specifically, I think the healthcare system will need to start considering how they're actually investing in communities, how they're contributing to limited housing resources, and also really supporting advocacy efforts to empower local communities to advocate for themselves. And I'll close by saying that health is a critical reason why housing matters. And if we think about health as a fundamental right, then we can also begin to think about housing as a right. And we have a long way to go, but I think that it is important to note that under the current presidency, we have seen mention of housing as a right in America, which at least is the first time I've seen this in a public discussion. And conversations are now beginning to at least start conversations on affordable housing and housing subsidies being a universal right. There's so much more work that needs to be done, but I look forward to questions and conversation on this topic.